Hello, I'm Matthew Wright, and I'm from MB Media Co-op, reporting from Moncton, New Brunswick, Canada. And I'm on the line today doing an interview with Janet Rodriguez, Community Outreach for Disability Without Poverty. Thanks for joining us today, Janet.
Well, thank you for the invitation, Matthew. I'm very excited to
And
be here.
yeah, first of all, would you tell us a little bit about Disability Without Poverty, when it was established, and what were the goals?
Sure. Disability Without Poverty started as a movement of advocates from a dozen different organizations in various provinces as a result of the 2020 throne speech, um, where the Prime Minister said that they were going to create a federal benefit for people with disabilities to help them leave poverty, because there's a high number of people with disabilities living in poverty. So we took his words at heart and started to call one another, did a Zoom thing, and started to organize. It was going full force with postcards, with letters to the MPs.
And it's the relationships that matter. And at Disability Without Poverty, we have built many wonderful relationships for which we are very grateful.
And suddenly, when COVID forced a second election for the federal government, all the initiatives went down. And when after the federal election re-elected that same party, we just took where we left off. The same MP that had uh, put the bill on the floor, Bill C-23. We again, the movement just grew. There were other organizations as well that joined with us, social groups, civil liberty groups. We didn't have funding, so we started to ask foundations for funding. And we absolutely needed to have American Sign Language for people who are deaf. And we also have the langue des signes québécois for the people who are deaf and speak French, and as well as we have every contact in writing or in our webinars, both in English and French, because our movement grew to be, coast to coast to coast.
Okay, that's great. How many people with disabilities are struggling with poverty right here in Canada?
Well, the percentages vary. 30%, 40% of those who self-identify as living with disabilities, which is a significant number. In Canada, 8 million people, according to the latest statistics reports, live with one or more disability, but it only counts people between the ages of 15 and 64. So the numbers of the younger people with disabilities, children, and the older than 65 is not included in that number of people. So it is a significant number.
That's most definitely. Prime Minister Mark Carney's government just tabled their first federal budget. What was your take on the budget from the anti-poverty perspective?
Well, we were asking as a movement, Disability Without Poverty was asking for eliminate the barriers to apply and receive the benefits. We were also asking for some kind of when you have to apply for this disability tax credit, you have to go to your doctors or your clinician to fill out the form that costs money. And so we were asking to be reimbursed for that expense. And we were also asking for a raise in the benefit because $200 a month is really not a lot. It's $6.66 a day, which is probably not enough for a coffee. And the law says that a person that qualifies may receive up to $200. So I could be receiving a dollar or $50 up to $200.
Yeah, for clarity, I actually went through the disability benefit and I qualified for $50 less than the 200. So it's 150 and change there that I was actually able to get.
Well, I'm glad you got the benefit, even though it's usually not what we expect or we
Yeah.
need. There's been the most current initiative we have. We are being sending a survey to all of the people that have attended our webinars, our town halls, and also people who participated in a survey we did in 2023, and to tell us, did you apply? Yes or no? Did you receive the benefit? Yes or no? What was the reason for the no? And so we're in the process of collecting this data, and hopefully we will be able to see if there's a, a reason that is repeated. It could be a barrier that I don't have a family doctor or my clinician refuses to sign. That's sometimes the case that they say, well, I don't know you and I don't want to touch this because it has to do with money, right? So, and we want to be able to see what are the facts on the ground. But yes, you're absolutely right. Sometimes people apply and they receive, if they want to disclose to us, they can tell us if they have received a full $200 amount or less.
Yep. Yeah. Your organization campaigned for the Canadian Disability Benefit, which is now in place. The new benefit provides up to $2,400 annually to low-income people from ages 18 to 64. How important is this benefit in your view, even though it's not a large amount?
It is absolutely important. Um, for many people, $6.66 a day could mean their food for the whole day. It could be the ability to um, take transportation for a medical appointment or a social appointment. It is important to break the isolation in which a lot of people with disability live. We know that isolation makes you more stressed and sick.
Yep.
It's considered like the diabetes, type 3 diabetes. So it is important for your health, for your mental health, and also just for your survival to cover your basic needs.
Yeah. They should have like they're trying to do a UBI here in New Brunswick now too. They just sent out a survey on that. I actually just filled it out there the other day, and one of the things I mentioned was the cost of living needed to be addressed with it, plus an extra 10%. Do you think that would be enough for UBI for somebody with disabilities?
So UBI would be the provincial benefit.
Yes.
Okay. So the short answer is no.
Yeah.
And I'm not just saying it from the top of my head. Last year, the Wellesley Institute here in Ontario did a research. I was able to participate along with other people with the cross disability community, and they issued a report, Thriving in the City with a Disability. And they found that people with disability need 32% more income than a non-disabled person in Toronto. And they were taking into consideration not the usual housing, food, and transportation, which
Okay.
is critical. They were considering, what do a person needs to thrive? Can you travel? Can you go to a show or a movie? Can you save money for after you retire or for an emergency? Can you plan for your future to, to prepare to purchase things ahead of time, not when they are broken and, go crazy how to repair them. So they saw how that people need to not just survive in the city, but thrive. And that was considering in the city of Toronto, because we have a closer system of transportation. In the city of Mississauga, which is just 20 minutes away, it's a suburb, it was 39% more because their housing system, their transportation system. So it was significant. And as you know, that 10% that UBI wants to install would be grossly inadequate.
Yeah, I just tried to give them a general idea, but I did mention that that people with disabilities, physical and mental disabilities, usually have a higher expense rate than a
Yeah.
non-disabled person. On another note, what's the percentage for people that are on food banks that are
Wow.
that identify as disabled?
It is alarming, I have to say. It is alarming for two reasons that no one in a country as rich as Canada, no one should be going to food bank unless you have like a critical emergency. I don't know, your house burned down or something. But people is the Who's Hungry report from the food banks of Canada, the Daily Bread, sorry, they said that at least 30%, and the number varies from year to year, 31%, 35% of people who get food from the food bank self-identified as disabled. And self-identifying is the key word here because there's a lot of people who live with pain or mental illness, substance use, and they just don't disclose. And because they go in and they walk in, you won't know unless they actually say, yes, I live with a disability. The second reason why it is alarming is because most of this work that the food banks do is they use for free the basements of churches, the basement of community centers, and that's usually not accessible. So the person that needs food, and some of us who live with disabilities cannot eat certain things. So if you cannot go downstairs and actually see what's available and choose what you need and what you can consume, you practically just hand them a bag and they, with the goodness of their heart, they just put whatever you may or may not need actually. So
Yeah, that's
it's
one of the barriers
unfair.
I have with the food bank that I'm with here in Moncton is the lack of accessibility for people in wheelchairs. I mean, they do their best and they try and help me out, and that they actually deliver the food to me.
Oh,
But
lovely.
I'm just wondering, when you're talking about the 32%, is that including people with disabilities, or is that including the caregivers as well?
No, that is the percentage that they had for a person with disability to thrive, right? So to
Yeah.
cover every expense you need and to have additional
Yeah.
income for the fun stuff. Um, I don't recall specifically for any support person or caregivers, but we know that in some provinces, like in Ontario, I have a PSW, which is part of the healthcare system. So I don't pay out of pocket. It's just pay through the taxes and through the OHIP system, which is the Ontario Health Insurance Plan. And for caregivers, we know that that is a $1 billion industry that is not paid. It's usually a relative, a neighbor, somebody that comes and helps you.
Anyways, what kind of obstacles exist in terms of how people can access the benefit?
Well, the obstacles are mostly bureaucratic. It's a lot of paperwork, red tape, forms to be filled out. And I'm not saying it with anger. I understand that when it's about money and your taxes, you definitely need the paperwork. But many people in Ontario that receive the ODSP, which is the provincial benefit, Ontario Disability Support Plan, they the amount that they receive is so small that they know they won't have to pay taxes. So therefore, they don't file the taxes every year and they never applied for the DTC, which is the disability tax credit, because there's no amount for them to get the credit. And for the DTC, It's very restricted, very regulated. You need to fill this form. The doctor needs to say these words. They need to know you and have an understanding on your disability, especially if it is something like chronic pain, mental illness, right? That is less visible. You cannot just walk into a doctor if they're not your doctor. They don't know you. And there's also a misnomer because my PSW went to her doctor and she works. She walks extremely slowly. She has a lot of pain. So I suggested you should look into this. And she went to the doctor and the doctor says, "You're not in a wheelchair. You're not disabled." So the misnomer is that they think you have to have a disability, and in their mind, disability means you're in a wheelchair, right? So there's a lot of barriers for persons to have the form filled out. As I said, some of them charge you up to $100 or more to get that form filled out. So people who live in disability are already stressed. If they can save one more stress, they never did it. But now, in order to get the CDB, the Canada Disability Benefit, they require to have filed taxes for the year before, the previous year, and they are also required to have the DTC certificate. And so now everybody's rushing to the doctors. The doctors are already busy. I don't know how is the situation in in New Brunswick, but in Ontario, there's 2.3 million people without a family doctor. So it's a lot of bureaucracy. So we were asking not only to raise the amount, which would be amazing, but also to eliminate the DTC. If there's people in Ontario who already went through the process and the Ontario government already revised their forms and said, yeah, this person is disabled, we're going to give them this benefit, why do we need to duplicate that? They already have been seen by the doctor, reviewed by the government, they are paying them the benefit, provincial benefit, they should automatically have a pathway to receive the CDB. So those are the things that we consider barriers, and also teaching and informing the community. Many people in the disability community, as I said at the beginning, live in isolation, so they don't know they could be receiving this benefit.
Yeah, I actually had to go down to social development there here this past summer, and people didn't even realize that there was a rent cap in New Brunswick. And I asked them about if they knew about the DTC. They looked at me as if I had three heads.
Wow.
Yeah,
Yeah.
yeah. They thought it was. They actually thought it was a big. It was something that I was making up, but I actually talked to member of parliament, my member of parliament, Jeanette Pettipaw Taylor, about that, and one of the things that she has mentioned is the tax systems are different, and what ways would you say they would have to be a change in the tax codes and stuff like that to coincide with this benefit, so there isn't such a gap, and we have to end up going to that doctor again, and the doctor has to see us, which, I mean, you know yourself, because doctors are very, very busy, very, 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 underline very, about 10 billion times busy, and they don't have time to be doing this paperwork for every level of government. So what advocacy could be done to bring the tax codes so that they're the same across the Canada and
Yeah.
at provincial and the federal level?
Well, I'm so happy you asked this question, and I'm happier that the Disability Without Poverty director, Ms. Rabia Heather, myself, and other people had a day of visits. Many of the Ontario government authorities, and when we presented this question, they said that there exists an agreement of sharing data between the provincial government and the federal government for tax purposes. So there's already an agreement to have this disclosure of data. The disclosure is very specific, right? So they have to say, we're going to allow each other to view each other's data for this reason, this reason, this reason. So for example, when I declare my taxes in one form, I have provincial and federal, so they can see that from each other. So we're asking, why can you not just extend that? And that obviously takes bureaucratic work, somebody who be convinced that this is necessary. One of the things that we heard actually was that some provinces acceptance of what a disability is may be different from what the government says what a disability is. I'll give you the example of Ontario. Folks that use substances that may have cognitive impairments as a result of substance use, then they are allowed because they are impaired. They have a disability, and most of them sometimes live in the streets. So they can receive this benefit within the scope of Ontario. And maybe the federal program needs to change that, or they need to have an agreement of what is disability or who is disabled in Canada. There's so many definitions, right? So this is a bigger task, if you wish. But when there's a will, there's a way. And this is where community on the ground, this movement, plays a big part, because if all of us send a letter to our MPs, if all of us have a friend, a colleague, a neighbor, a coworker, a classmate, and convince them, hey, I'll send you an email. All you have to do is just click and send it to your MP. That way, one person can make a bigger difference, and within their own circle, they can put that pressure, especially because they know civil society votes. And every email they receive is one potential vote, right? So we need work to do.
Yep. All right. I thank you very much
Can
for
I
your
say
time.
just can I say just one last thing?
Oh, sure.
Disability Without Poverty is organizing the first ever symposium on research, and it's going to happen on December 3rd. It's virtual on December 3rd, and it is going to be the whole day, well, the many hours, and we made a call in. A lot of people have presented research about disability. There's visuals, there's videos, and there's talk and discussions in English, and there's one session in French, en français.
Thank you for tuning in today. You've heard from Janet Rodriguez from Disability Without Poverty. I'm Matthew Wright from MB Media Co-op.